Did you know that prenatal stress and birth trauma are amongst the top reasons that babies struggle in their first few years of life? From colic to constipation, sleep struggles, torticollis, plagiocephaly, tummy aches, leading into their older years of sensory struggles, ADHD, and anxiety. The list seems never ending. What we are seeing today in offices all over the country is that the paperwork always has one common denominator. Moms will say, quote, "I was so stressed out during pregnancy," or "I had such a traumatic birth. I remember the doctor having to pull so hard to get the baby out." Other things we've heard are, "I lost a level in while I was pregnant," or "This is my rainbow baby after numerous miscarriages." Stress, stress, and more stress. So how can we help ease this stress for both expecting mothers and babies? Obviously, we can't control what happens in life, but we can help the nervous system be able to work through and process this trauma easier so that both mom and baby will be more adaptable and resilient to all that life brings, hoping to possibly avoid some of the common symptoms that we mentioned earlier that we see with babies after birth. If you're an expecting mom or want kids in the future, keep watching this video as we will talk about how you can start influencing your child's nervous system even before they are born. This video is for expectant parents, those planning to have babies in the future, families who want more babies, and anyone curious about how to have the best pregnancy and help learn more about the development of baby's nervous system. We're diving deep into the health of mom's nervous system during pregnancy and how it can influence baby's nervous system development within utero. You'll learn how the vagus nerve influences your baby's growth, why it matters for long-term health, and how you can support optimal development during pregnancy and beyond. So, at Innate Family Chiropractic, we specialize in cases that involve birth trauma. Sweet babies come in who struggle with colic, eczema, and sleep challenges. We also have toddlers and elementary age kiddos who suffered from these challenges as babies and then have grown into diagnoses like SPD, ADHD, OCD, ODD, and ASD, or autism. As we mentioned earlier, in most of these cases, mom had mentioned fertility struggles, a stressful pregnancy, or a traumatic birth. These three things are very likely, especially with how medicalized our country has become with prenatal care. So let's look at some stats to paint the full picture. So America spends close to $100 billion a year on birth. 1 in 3 American women have a C-section. The WHO recommends 10 to 15% at most, and deemed a true medical emergency. But 75% of American women receive an epidural. 31% of women are induced. 1 out of 7 American women experience a postpartum mood and anxiety disorder. The fertility market in 22 was $7.9 billion, and it's projected to be $16.8 billion in 28. And 65% of women are on hormonal birth control. I am so grateful for emergency medicine in the U.S. We are number 1 in the world for emergency care. But unfortunately for maternal and infant outcomes, we rank dead last at 55%. Again, not everything in our control, but as a whole, something isn't quite right here. Medical intervention is definitely needed in true emergency circumstances, but not everyone should turn out to be an emergency pregnancy and birth. For low-risk pregnancy, too much interference is happening, leading to a cascade of events we call the perfect storm, which are all of those common symptoms and diagnoses that we are seeing time and time again in our office. So how can we best prepare our mind and body for pregnancy and birth so we can have the best outcome possible for both mom and baby? Let's go through 4 tips. Stick around for tip number 4 because it's going to be the most important. Tip number 1. Empowerment plus knowledge. Have you ever heard the saying, birth is 80% mental, 20% physical? One mom recounts that, "When people told me this before having a baby, I never believed them. But after prepping for birth and studying for it, I had my dream birth, and that's when I did believe it." The 20% comes right at the end when you completely surrender to your body and let it do what it was meant to do. When you're more educated, you know more and will do the best you can. Understanding your body and your birth is vitally important. Tip number 2, start to prepare even before conception. This is for couples who know they want a baby in the future or ones who are going through fertility struggles. There is so much that you can do to prepare your body. We call this preconception work. It's doing all you can do to be the healthiest version of yourself. If you attend our workshop, we go into more detail on this, but at least 3 to 6 months before trying to conceive, start becoming the healthiest version of yourselves, both mom and dad. A big misconception is that prenatal life is all on mom, but this isn't true at all. Mom and dad play an equal role, especially in preparing for conception and the fertility phase of it all. You are creating a baby that is half of you and half of your partner. Tip number 3, find your circle. This is so important. Surround yourself with people who protect your vision for your birth. You want friends and family who are supportive of how you envision it all to go. It's okay to build boundaries around yourself during this time and say that you don't really want to hear about their birth story if it isn't going to be in a positive light. Find providers who align with your vision and answer your questions. You should never feel belittled or irrelevant. Your providers work for you. Tip number 4, nervous system health. Finally, the most important one of them all, making sure that your nervous system is adaptable and resilient so whatever life throws your way, you and your baby can process through it and not store trauma within your bodies, but instead recognize it, process it, and adapt accordingly. So let's break it down. Let's start with the most basic understanding. The nervous system controls every cell, organ, tissue, and system of mom's and a baby's body too. A lot of the time, hormones get blamed for everything in pregnancy, from crying to mood swings to more serious topics such as fertility struggles and miscarriages. Doctors love to run to the chemical imbalance of hormones. As this is true, is it really the root cause? What system regulates hormones and decides which ones are needed at specific times? The nervous system. There's your root cause. When the nervous system is dysregulated, many common symptoms occur. Things like cramps during periods, increased symptoms from endometriosis and PCOS, fertility struggles, miscarriages, pregnancy pains, morning sickness and nausea, high blood pressure, constipation. Whatever the symptoms are, we can almost always trace it back to the nervous system. So how can you check if your nervous system is ready to make a baby, have a great pregnancy, and conquer birth and postpartum? The first step is to measure your heart rate variability. We do this at Innate Family Chiropractic using a technology that is far more advanced than the Whoop, Garmin, and Apple Watches and Oura Rings. We love those gadgets for daily use, but this will tell us overall how your nervous system is adapting to stress and if your body battery is ready to take on this prenatal season. This will also tell us how baby is adapting to stress as well, as whatever mom experiences, so will the baby. So we need them to be adaptable too. We also will do 2 other scans that will tell us even more about your nervous system. Those 2 are also fast and non-invasive. They will tell us how your brain is communicating with the rest of your body, where you are storing and holding your energy, and how your nervous system is processing and dealing with stressors like trauma and toxins. The central nervous system is the biggest reproductive organ that we have. It controls all other organs and hormones, so we need it to be functioning at its best for preconception, pregnancy, and well after birth and postpartum. If you want to see how your nervous system is functioning, DM us and get your neurological insight scans scheduled right away. That way, our doctor, me, can read them, look over your history, and create a customized care plan for you and your baby. we have the opportunity to impact baby's nervous system even before birth, which is wild. And I am so thankful for that. As we said, we aren't in control of many things, but we can control how our system reacts to stress. We can have better outcomes and hopefully avoid the norm that is happening to so many kids today. For more information, visit the link in our bio and sign up for our upcoming workshop. Our team can't wait to connect with you.